The thing that this box does that no other one to the market yet does is it measures central blood pressure. So when I was still an invasive cardiologist, we would feed a catheter into your radial artery or femoral artery and put a pigtail catheter in your aorta, and we can measure your blood pressure in your aorta and then measure the blood pressure in your left ventricle.
Why would someone want that?
Well, when you're doing a procedure, it's kind of a good idea to know kind of like how well their heart's working, because the higher the pressure in the aorta, the higher the pressure in the coronary arteries, and the more likely that high shear stress could damage the coronary arteries. So nobody wants me putting catheters in them just to measure that pressure, but this device can assess what that pressure would be. So it's basically assessing how stiff the arteries are, because, for example, if your heart's beating 60 beats a minute, the left ventricle pumps, the blood comes out of the heart, goes down to your legs, and it's going to hit those arteries in your legs, the iliac arteries, and it's going to be a reflection wave. It can measure how fast that blood is coming back, and that estimates what is the blood pressure that's coming out of your heart. Because that central blood pressure is what the blood pressure that your brain, when you talk about the patients who are geriatric and you don't want to affect their central perfusion, it's that central pressure that you want to focus on. That's the pressure that the coronary arteries, the heart arteries, and then also your kidney arteries, that's what they sense. So if your central blood pressure is normal, less than 120/80, but the arm is 150, leave them alone. Their perfusion in the brain is perfect. Don't mess with them. So you want to treat their central blood pressure. You don't want to treat just brachial.
The reason I asked you that question is if someone is just getting a brachial artery blood pressure, which is what would be standard, and an individual is treated off of that, is it true that they might not need it because it's not actually measuring the central blood pressure?
Correct. And that's sometimes the cases where the person says, like, I'm taking the medicines, I'm getting really lightheaded and dizzy at home. I don't feel good. And you check the blood pressure in their arm in the office and they're like 125. And you're like, well, your pressure's a little bit high. Their central pressure is probably like 100/60. And their brain is like, hey, I need a little bit higher perfusion pressure. So maybe you need to back off, let the brachial run a little bit higher. So that's why this device is going to probably be a game changer for many people who are at high risk or just very interested in their vascular health, because this is kind of like the check engine light going on. When your central pressure starts to rise, you have a problem.